Pura Baba, condition 14 Feb 2022. Chief complaints: pain, right upper abdomen, 6 months. History of present illness: patient was in normal state of health 6 months ago when he developed pain in right hypogonadism. Pain was moderate intensity and collegial in nature. Pain is relieved by medication and aggravated by meals. Now pain is accompanied by vomiting for the last 10 days. Patient known case of hypertension on medicine, no history of diabetes, mellitus, no history of ischemic heart disease, posterior surgery done 4 years back under GA. Personal history: all man of 72 years age, living retired life, non-smoker, married with 3 children, belongs to poor social class. He was diagnosed as a case of polynucleosis and laparoscopic cholecystectomy was planned on 15 Feb 2022. Pre-anesthesia assessment. Pre-anesthesia assessment was done on 14 Feb 2022 in evening. An old man of weak build, lying comfortably in bed, weight 60 kg, pulse 85 per minute, BP 140, 9 pm per mercury, temperature 98 Fahrenheit. Airway assessment: poor oral hygiene, some teeth in upper and lower jaw were missing and atrophied. In this slide, we see the malapathy, which is class 1. Respiratory system: normal breathing sound, no added sound. CVS: normal heart sound, no murmurs. Investigation: HB 12.5, urine normal, ECG within normal limits. Echocardiogram: normal, patient declared ASA class 2 and fit for general anesthesia. In this figure, you see the ECG. This is the echocardiogram of the patient. Ejection fraction 60%. Pre-medication: tablet midazolam 7.5 mg at night, routine antihypertensive with sip of water at 5 am on 15 Feb 2022. Patient was shifted to OT on 15 Feb. BP was 183 by 87, pulse 76 per minute. As seen in this slide, the patient's vital. Anesthesia technique: deoxygenation with 100% oxygen for 3 minutes. Induction: propofol 150 mg IV, relaxant Atlex 35 mg IV,